Can everyone hear me all right? Wonderful.
Yeah, thank you for joining us today. We're going to have a conversation about climate change and health, and particularly focusing on how can we affect change in the public health sector to really better emphasize the ways that climate change might influence programs, or that integrating climate change into health might help lead to better outcomes. So I'm Robert Beach. I'm a senior economist and fellow at RTI International, and work on one of my focus areas is working on potential impacts of climate change on nutrition through effects on crop yields and nutrient content of crops. And so I'd started doing some work thinking about how climate might impact health through that pathway. And then building off of that, I've been interacting with colleagues who are focused in the health sector, and really trying to think with them in collaboration about ways in which climate change could be better integrated into some of what they do. There's a large amount of health work ongoing at RTI as well as many other places, but a lot of times there's a disconnect between some of that work and reflecting the influence that climate change may have, or the influence that it may bring.
Yeah, and my name is Alicia Smith Arthur. I'm the Director for Global Health Security and Public Health Preparedness at RTI International. So I come to the climate change debate through a focus on infectious diseases primarily, and an interest in looking at how we can make health systems more resilient to emerging threats, especially pandemics. But I have a strong interest in how we can leverage some of the work that we're doing also now to incorporate a stronger lens on climate preparedness and understanding really where those links are. And so I'm really excited about the COP meeting this year with the new focus on health. I think it's a great moment to really bring those issues much more to the fore. I think we've been a little slow. We've been a little late to the party. And I think that the emerging consensus that we will not meet our global health goals, our SDG goals, our goals for maternal and child health and for health system strengthening and for pandemic response, unless we do a lot more very urgently to incorporate a climate focus. So I'm enjoying myself so far on day 2 or 3. And looking forward to what we can learn, and also I think what we can bring to the table from all of the learnings that we have.
And so, Alicia, this is the first time you've been at a COP meeting, and the first time that there's been a health day, specifically a health day at the COP meetings, reflecting some growing attention to it. So what gets you excited about being here for the first time and participating in the conversation and seeing some of what's going on?
Yeah, the most exciting thing is just the energy itself. I think the vibrancy of the discussions and how much has been done and how much really we know about how to mitigate and adapt. And I think that there are just so many ready-made lessons that the health sector can take up, and it's really been kind of a journey for me to almost be a student in some of these discussions and understanding things about energy and about all of these sectors that I don't stop and think about enough on my day-to-day. And it's really illuminating a lot of the linkages. I think we all talk about silos, and we all talk about how we sort of operate in a channel. This has just been so interesting to understand sort of what's going on and how we can absorb that energy and take up some of those lessons, and also just learning about all of this sort of COP COP infrastructure and how all of that works is quite exciting as well. What about you? How does this COP so far differ from COPs you've been to in the past, or is there anything that's really jumped out at you so far?
Well, it's still early on. This is the first day I've been here, but it is certainly I think it's exciting to see that there is a growing attention to health issues. There's also been growing attention to food and nutrition in the last couple of years. A lot of sectors that have been growing in how much attention they're being paid at the negotiations and in the scientific community as well to really better reflect more holistically the really large integrated impacts that climate has really across all sectors. I think it's interesting to see that and just how many and just that it continues to grow in size, and certainly it reflects interest and excitement around the world in engaging and in trying to uh, really build energy towards moving us to solutions.
Yeah, what I find really exciting is that we are really at a moment now where not only do we have evidence, the evidence has really come together, and we really have a clear picture of what the impacts of climate change are on health in a myriad of ways. And it's finally resulting in a call to action. And I think those calls that are coming up in many different spaces. So WHO released a call to action. There was a important MOU signed between the Global Fund and the World Bank to integrate climate more into Global Fund programs against TB, AIDS, and malaria. There's a new call to action between UNFPA and UNICEF around climate and maternal health. So there's a lot of momentum to take the evidence we know about how climate change affects the health, resilience, and the ability to thrive of children, mothers, families, and translate that into guidance and really kind of push forward. And I think we're also seeing it in all of the health activists that are here as well, who are saying that, this really affirms our lived experience, that we are, communities that are climate vulnerable are not communities that are going to be able to invest in their own health or be able to achieve the health outcomes that they hope and that they need. So my biggest question and my biggest concern coming out of this is, what are we going to do? We, as sort of the global health community, as researchers, as implementers, as a donor community, how can we respond to those two trends, the guidance and the call for action that's coming out at the high level, and also this push from the communities that we serve, who are saying that this is really our day-to-day. We have to do better. And I think that there's a lot that we need to do to kind of catch up around our systems and our structures and our programs to really make sure that we can make that a reality on the ground.
Yeah, I think that's a really good. That's an excellent point. And there have been a lot of high-level declarations from WHO and in the U.S., the Centers for Disease Control, and others highlighting how important climate is and identifying it as the largest challenge to global health. But I mean, you've worked on a number of health projects on implementing them on the ground, and so when you get to that level, what barriers have you seen, or have you experienced in actually in seeing that reflected in the programs that you're implementing?
I think climate is sometimes perceived as a debilitatingly large problem. I think that climate affects health in a myriad of ways that are almost seem too innumerable. And I think that there can be a real paralysis around action related to the scope of the problem. And when thinking about what to do with that, I think that something that we've tried and something that we're continuing to do is to help. You really have to support the prioritization of the problem and really helping communities, systems, health actors better quantify the specific data around what their climate-related health challenges are and help them really kind of bring the problem down to earth in terms of what is the scope of the challenge in different parts of the health sector so that we can help build the evidence so that it's not nobody's problem because it's such a big problem. And I think this really builds off some work that you've been doing in your practice area as well, and some of the research that RTI is doing to build evidence around linkages between nutrition and health.
Yeah, that's right. We've been doing some work, again, looking at the ways that climate change, through its influences on agricultural productivity and nutrient content of foods, so it may directly influence the quality or nutrients available in food, but it also makes food more expensive and less affordable and affects food security through those pathways. Another thing we've been working on a little more broadly too is really trying to bring together some of the work that our colleagues that have been more focused in the health area, where they're thinking about the impacts of social determinants of health, things like infrastructure and access to jobs and a lot of just community characteristics that may influence health. And so one of the things that we've been thinking about is how to better characterize or reflect all the ways that climate potentially impacts those social determinants of health. And so in addition to like some of the direct impacts on health, sometimes people think of that more directly. You're impacted by a natural disaster or which certainly is a major concern as well, and that may disrupt your access to healthcare and have other impacts. But there are also indirect impacts on people's health by affecting these social determinants of health and negatively impacting local infrastructure, or impacting job availability and incomes that make it more difficult to afford healthy, nutritious food for one, but also to maybe afford healthcare or to afford or to access safe water or other things that are going to influence health. So there's really a whole array of pathways through which climate can potentially influence people's health, and and we're trying to do more to try to quantitatively model some of that and put a clear picture on what are some of the really important linkages and then ultimately working towards and so what are ways what can be done, recognizing what some of the important linkages are, what can be done then to mitigate some of the negative impacts that are coming through those all the myriad pathways through which climate is impacting health.
Yeah. The Lancet recently reported that 127 million more people were food insecure in 2021 than in previous years. And that food insecurity will have profound effects on people's ability to maintain HIV treatment, to prevent TB infections, really have a lot of, knock-on effects for a lot of other health conditions. And so being able to break that down in real terms for countries so that they can understand, the food insecure populations that are also intersecting with the health sector for other disease areas, and how we can build stronger programs to support people who are experiencing climate-related food insecurity, for example. Another thing that we're working to do is to strengthen our surveillance systems to make them more climate sensitive. We will not be able to combat infectious diseases, even the ones that we have really made progress on, like some of the neglected tropical diseases that we've been working with countries to eliminate, or malaria, we will not be able to either continue to make progress or to maintain the progress that has been made if we do not have more climate resilient systems. And that starts with data. That starts with understanding in a given country, because of changes in seasonal rainfall, because of changes in heat, because of changes in population mobility related to climate stressors. We will continue to see new and novel ways that pathogens are interacting with both the environment and populations. And breaking that down and having surveillance systems that can really quantify that and demonstrate the trends so that we can plan better, so that we can make sure that the tests and the medicines are where they need to be, when they need to be, so that we can, make sure that we can guard against re-emergence. Those are some of the things that we are working on in the health systems that we support, and it's very tied to what I do, also around protecting against novel pathogens. So the same kind of data, the same surveillance networks, the same work to strengthen the health system will also help us, hopefully, guard against the disease X, which could also, have a climate-induced angle.
Yeah, no, that's a really interesting point. I mean, so you could see diseases changing their ranges, and some of the past vectors for disease also, moving into new areas, and so having surveillance in place and sort of getting ahead of that, being aware of where this is happening or likely to happen next, forms a really important part of our being prepared and able to better adapt and contain some of those infectious diseases. So, in your experience, have you found some success stories in being able to bring to reflect climate change successfully within some of the health programs?
This may not be exactly what you're asking, but I think a really critical success story was the way that much of the global health community, our global system of donors, our implementing partners, and our countries were able to really respond when they needed to during COVID. I think that really is the kind of level of almost like the systemic gut check that we need to have. That kind of response is really what we need in the health sector, as a sort of COVID style kind of kick in the teeth, sort of like, we have to change, we have to come together, we have to do this urgently, we have to really, I think that's the response, that when we want to, we can have that kind of, jump start. And I worry that we won't have that sort of, okay, let's all come to the table, let's all really embrace this urgency, and let's all really understand how we need to change and adapt quickly. But I know that we can, because we did. When we felt the threat, when we felt it urgently, we did say, okay, whatever it takes, we're going to figure this out. Not in all places as successfully as we wanted to. But I think that's kind of the lesson of, the threat right now is not just obviously the threat of climate change, but it's this threat of that kind of paralysis, that sense of the issues are too big, I'm doing too many other things, there's too many other, health itself is just, oh God, there's so much that needs to be done, so we won't really do anything, and we'll kind of let this moment pass us by. These calls to action will, we'll be right back here a year from now and saying, what progress did we make? Well, maybe not as much as we wanted to. So what I really hope is that this momentum will build. And I'm really looking to the voices from the communities, from all the activists here, to also continue to give that push, so that we can we can really lean into these issues and, not put them down the road for, it's been 28 years for us to get here. we don't have 28 years to, figure this out. So I don't know if that answers your questions, but I think that COVID showed us what's possible when we want it to be possible.
Yeah, maybe when there's a need that's pressing enough, because to your point, it's often easy um, and understandable to put it off when you have a lot of other pressing, competing priorities for resources and for people's time and attention. Um, and to your point, I mean, there's, of course, we talked about the importance of really building these collaborations between people more focused on environment and climate and health in the past, including last year at the COP. But we do have the first health day here,
Yeah.
and it seems there is some momentum in that direction of really um, bringing those communities together. But it is a big ongoing, maybe longer term challenge, just to increase interactions and communication.
Yeah.
Sometimes these communities speak different languages to
Yeah.
some extent.
But I think that building the data, showing the evidence in really
Mhm.
concrete terms, and helping that immediately shape policy action, shape intervention, shape how we can actually implement climate adaptation plans
Uh-huh.
in real terms, with new creative partnerships. I think
Mhm.
I think the door is open for us.
Mhm. No, that's right. Yeah, demonstrating. I think showing demonstrated ways um, that it can make a difference, that it can help. It can help you develop um, better, more effective programs when you think maybe more broadly outside of a single disease or a single type of intervention, and think more broadly about what are the other interactions, like you'd mentioned earlier. I mean, things like food insecurity that may increase your vulnerability to all sorts of different diseases. Thinking more, maybe more broadly, more holistically, um, and identifying or creating more venues where there are opportunities for exchanges and interaction between people that are more focused on environment and climate and those that are more focused on health interventions.
Yeah, so I'm hopeful. I'm hopeful. I think
Yeah.
there's just a tremendous, like I said, the energy here is amazing. There's a tremendous amount of smart people. I think if we continue to work together, I think we can make a difference. So, um, my goal is I'm gonna take off my hat, or I'm gonna expand my hat. So I'm not just an infectious disease person or a health security person. I am now a health security and climate person. Yeah.
Yeah. No, I think that's important takeaway for all of us. Just thinking about how you can reach outside, maybe where your your comfort zone, your main area, and think about just the as integrated as climate is, thinking more
Yeah.
broadly, collaborating maybe more broadly with more multidisciplinary group, and really thinking about how we can leverage that to come up with better solutions.
Yeah. I, I think that's right. Well, I appreciated the chance to talk with you about this. I look forward to, I think we have each, another week here or so, or combined.
Yeah.
So really looking forward to all of the things that we're going to learn.
Yeah. No, I'm looking forward to the rest of these meetings as well, and lots of great opportunities to learn and exchange and identify there's new opportunities for collaboration.
All right. Thank you very much.
All right. Yeah. Thank you.